We are live. We are live. I'm Dr. Frita. Welcome to Medical Monday, where we give you celebrity health and all of the hot health topics in the headlines. Oh, I have a power-packed show for you today. We're going to open up talking about Trump's MRI and Trump's health. Okay, I've been talking about this across social media platforms, on national news shows. I was on the Don Lemon show talking about it. I've been in the comments tussling about it. And so let's continue this conversation and really break it down. We know that Trump had an MRI in a second routine visit. And so we're going to break down all of his health issues and see if these checkups are just routine or are they red flags. And so we'll speculate as to what's going on with President Trump's health. And we'll ask the question, do we have a right to know? Does he need to be transparent? And why are they playing with us? Okay, we know there's something a little deeper than what he's sharing. And then we'll talk about a former Fresh Prince of Bel-Air star. It's someone who passed away at the age of 42 after having 4 heart attacks. Yes, he had 4 heart attacks by the age of 42. And so we'll talk about what you need to know about heart disease, which is the #1 cause of death, and then what could cause someone to pass away at such an early age and to have so many heart attacks at an early age. We'll get into it. And then, of course, we can't get out of here without playing my favorite game, Myth versus Fact. And today, our Myth versus Fact segment will be on the flu versus pneumonia. I got a question from a viewer about, pneumonia and some things that we've talked about. And so we'll go into detail and we'll talk about the influenza virus versus pneumonia and what you need to know, because guess what? We're in the season. And then, hey, why stop there? I'll give you a second weekly dose, where I give you a fresh take on medicine that you can't receive anywhere else. And for this one, we'll be talking about kidney disease. And of course, I am a board certified kidney doctor. We actually lost a young NFL player. He passed away at the age of 41, Nick Mangold, and he passed away with kidney disease. And so we'll talk about the causes of kidney disease and what could cause someone to pass away at such an early age. And then we'll talk about RFK Jr. Oh my goodness. Why must I keep his name in my mouth? Because he keeps showing up in the headlines where it affects health. Well, you remember he came out strongly talking about Tylenol and how you just should not take it. And he was giving a lot of absolutes and saying it caused autism, especially when pregnant moms took it. But would you believe that he's backpedaling? Oh, he is. And now he's starting to sound a little bit more like I've been sounding and like other medical doctors and healthcare professionals have been sounding. He's starting to walk things back and move towards evidence. That's where we are. We're at the evidence-based medicine. And so please go ahead and give us a like and a subscribe and a follow as we get started, because this is Medical Monday. We're about to get into the celebrity health, all of the hot health topics in the headlines, and I guarantee you are going to learn something today. So let's get started. Hello. We're live. I'm Dr. Frita. This is Medical Monday, where we talk about celebrity health and all of the hot health topics in the headlines. I don't do this thing alone. So will my co-host and my office manager, Miss Shador, please come to the front of the stage? How you doing, Miss Shador?
Hey, good. Dr. Frita, how are you?
I'm good. You had Halloween with the little one. How did it go? How did the costume turn out?
It went well. It went great. He was excited. A lot of other kids were excited to see it, even some adults. So he got some pretty good compliments on it.
Good.
And extra candy. It got him extra candy.
Oh, I know that's right. Oh, I'm sure he's happy about that. So yeah, you did this costume. You didn't do a store-bought one. You made it yourself. He was a helicopter, moving propellers, lights, all the things.
Absolutely.
That is so good. You're so creative. And he was so excited. He was so excited about the costumes. I can't wait to see pictures. Very good. All right. Well, on this end, there was no trick-or-treating, but I let my 9th grade twins, my son and my daughter, actually have a Halloween party. And and I actually did a post because, growing up, Shador, my mama didn't too much let us celebrate Halloween. She called it the Devil's Day. I had my ways of getting candy. Don't worry about that. But so this really is out of my comfort zone. I've never let a child host a Halloween party. Didn't love them going to Halloween parties. I would let them do like trunk or treat at church sometimes, things of that nature. But we hosted it. And, I don't think there were any exorcisms. I don't think that there was any devil worship. We ended up having a pretty safe time. And on some of my other social media platforms, I actually did post this morning a little compilation of homecoming to Halloween, with the twins in their 9th grade year, their homecoming celebration, and then the Halloween party. And so that was quite fun. And then, of course, on the next day, Saturday, I went to FAMU, Florida A&M University, where my oldest daughter, my 19-year-old, is a member of the marching band, the Marching 100. It was their last home game of the year. They played against Jackson State. And let me tell you, the band won.
Oh, yay.
The band is always the star of the show. Florida A&M, FAMU Marching 100. I was very proud of my daughter. She's a trumpet. And I was hollering, saying her whole name. I was like, "Did you hear me? Did you hear me?" And she was like, "Of course I heard you. And why were you hollering my entire government name?" Anyway, but yeah, we had an action-packed weekend. So, you know what else is action-packed, Shador?
It's Medical Monday.
This Medical Monday, these headlines. So let's go ahead and get started. Please go ahead and give us a like and tell me who's the first one in the chat today, Shador.
Absolutely. First person in the chat today is Miss Marina.
Yay, welcome back. I'm glad to have you.
She says, "Good morning, good Monday morning, Dr. Frita and Shador from Arizona, where there's no daylight saving time."
Oh, that's right. No daylight saving time. Oh gosh. Well, we certainly have it here. And I'll be honest, I was traveling. I really didn't too much notice it on the weekend. But when I used to be in that hospital doing rounds on the weekends, I used to really love to fall back. All right, Marina's not falling back. She's staying right still. And I hope you're ready because, I'm going to ask you questions, Marina. I'm looking for participation. All right, so let's get started with our first story. Let's talk about President Trump. Now, last week I told y'all that I was on the Don Lemon show talking about his MRI, and I thought it would be perhaps out of the headlines by now, but it's still going strong. People have asked me a lot of questions. I posted a short form content this weekend. You can see it right here on YouTube after we finish the live. You can also catch it on my other social media platforms. Make sure you follow me on all social media platforms at dr.frita, because I actually give different takes on different platforms. I give different bits of information. I always have the same take, child, but I just give you different information. So, yeah. And so I've been tussling with some people about his health. But what I'd like to do now is have an exercise in differential diagnosis, meaning that when you are a physician, like I am, when someone presents with certain symptoms, certain signs, then you always formulate a list of possible diagnoses. We call it a differential diagnosis. What could it be based on the signs and symptoms being presented? And so I want us just to do that intellectual exercise when it comes to Donald Trump. Now, mind you, I'm not his physician. I don't know any more about his health than what the general population knows, but I do want to take what we've seen, what we've witnessed objectively, and talk about it. So let's go ahead and play this clip. And then I'm going to ask you guys what you think as we get into the differential diagnosis of Donald Trump.
President Trump is showing off his vitality, dancing with locals as he landed in faraway Malaysia. But there are new questions about his health today after he revealed that he had an MRI at his hospital checkup earlier this month.
I got an MRI, it was perfect. Yeah. I mean, I gave you the full results. The doctor said some of the best reports for the age, some of the best reports they've ever seen.
The White House has not released the results of the president's tests. His doctor wrote a memo stating in general terms that the president underwent advanced imaging to ensure optimal cardiovascular health, and concluded that President Trump remains in exceptional health.
The big question is what prompted his MRI. So what symptoms were they concerned about? What particular type of MRI was performed? Was it a brain MRI? Was it a cardiac MRI?
Trump has been having circulation issues. His ankles remain noticeably swollen in meetings during his tour of Asia.
The president said the results were great, and that's fabulous. And that'll be very reassuring for the public. But when you hide things from the public, people will typically imagine conditions that are much worse than the truth.
Meanwhile, Trump was asked if he'll run for a third term in 2028 and didn't rule it out.
I would love to do it. I have my best numbers ever. Am I not ruling it out? I mean, you'll have to tell me.
The Constitution bans all presidents from running for a third term.
All right. So, yeah, let's go ahead and let's break down different things that are going on with him. We'll start with the MRI and then what those possibilities could be. And then we'll move on through to some of his other symptoms. I do want you to put this in the chat, please. And hello to everyone on IG. Hello, Facebook. Hello, hey, replay crew. I know you're here. Come on in, give us a like and comment. So I want you to put Trump so we know that what you're answering, and answer this question, please. Because he is our president, do we as a public have a right to know what's going on with him medically, or is he entitled to privacy? Okay, do we have a right to know, or do we need to leave him alone and let him have his privacy? And please give me a why to whatever your thought process is. Are we doing too much? Is it just political noise, or does it mean something? All right, so, and make sure you can go ahead and interject, please, any questions that you all have or comments as you go. And if you put Trump by them, then when I take a pause, we can pick those up. So let's just start off here. So he had his initial annual routine exam back in April, and then President Trump went in for a second routine exam just 6 months later. Some people refer to it as his annual exam the second time, but of course, annual is just once a year. So already that was a red flag that something was different. And afterwards, President Trump revealed that he had an MRI, and he said, oh, it was excellent. But when he was asked questions about it, he was quite vague. And he said, oh, ask the doctors. Okay. The doctors gave us this really non-specific memo saying, yeah, he's in exceptional health and he had advanced imaging. That sounds fancy. It does not mean a whole lot. It doesn't answer the question. Why did he have the MRI? And so let's break down what possibly could be going on with President Trump. And if you have your thoughts of what could be going on, again, put Trump so we know what you're answering, and write in there, what kind of diagnosis you think he might have, understanding this is speculation and this is something we're doing just as a learning tool here on Medical Monday. And for those of you who are new to us, I am Dr. Frita. I'm an MD. I'm a board certified medical doctor. I've been quadruple board certified. So I'm a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I've also been board certified in internal medicine, pediatrics, as well as obesity medicine. So I love to talk about a lot of medicine. More importantly, I love to share it. I do a lot of media. So different television shows like the National News Show, News Nation, HLN. I've been on the Emmy Award-winning Paternity Court as a medical expert several times, Revolt TV, The Griot, Don Lemon Show several times. And so I just really love sharing medical information. And if you want to see some of my television appearances after this live, just go right here to the YouTube channel under my playlist, and I have television appearances there. All right, so let's start off talking, back to this MRI. When an MRI is done, it is not done for no reason. It's not done just for fun. We're usually looking for something. So at this point, it has not been revealed from the White House why Trump had the MRI, but there's a reason. So what could the reason be? So one thing that has been speculated is just based on observation. We've seen that at times, Trump will be forgetful. Okay. He'll have some, what looks like little memory lapses, and he is 79 years old. Sometimes he even babbles. Well, he'll say words that are incoherent, and one might call this confabulation. He's done this several times in his public appearances. Other things that we can note, we've seen him walk in a way that's not in a straight line. Okay. He's visited other countries and has been wandering where it seems like people have had to get him and put him back on track. And that could have several explanations. One could be a neurological issue. And then even when he's been on a red carpet coming off of Air Force One, there's been times where he's had an abnormal gait, meaning he's not walking in a straight line. He's just kind of wandering back and forth. Could this be a neurological issue? Well, as a physician, when I observe this, I do go through a differential diagnosis. He's 79. Could he just have some age-appropriate forgetfulness? Sure. But could it be something more serious like a dementia, like Alzheimer's disease? Absolutely. It's a possibility. This is speculation. I do not know. Also, could he have had a stroke? Could he have had a brain bleed? Could he have had an ischemic stroke or cerebrovascular accident? Does he have something that's going on with him neurologically, like an ataxia, something going on with the cerebellum at the base of the brain? Well, if I were suspicious of any of those things, I would do some brain imaging, such as a brain MRI. So that's one big question that I have. Did he have a brain MRI? I don't know. All right, Shador, so far, has anyone said anything? And then we'll go back to more as I keep going.
Yes, ma'am. Absolutely.
Okay.
Our member, Mr. Joe,
Thank you for being a member, Mr. Joe.
he says, we have a right to know.
Okay.
Lisa says, absolutely. We need to know because if something happened to him, we would want to know why, especially if the vice president has to be in charge.
True. Okay. Okay.
Sheree. Hey, Sheree.
Hi, Sheree.
We need to know if it's something that is going to affect his ability to govern.
Very good. So not even for petty reasons. There's no nanny boo nanny boo boo. I have to go back to elementary school. None of that. But really, the way that you all have lined it out for very logical, reasonable reasons. And while we as regular citizens do have the right to privacy, HIPAA's in effect, you do give up a certain amount of privacy when you are in the most powerful position, arguably, in the world. All the presidents have shared before him. They've had to be transparent about their health. And so I do agree with those of you who say that we do have a right to know what's going on as a public for reasons of understanding who is holding on to the nuclear codes. If there's some type of a neurological issue, then certainly we need to know so that we can, our minds can be at ease that the mind of our president is, something that is secure. Okay. So yeah. So one thing that I was thinking, did he have a brain MRI? The other possibility, especially when I think about his abnormal gait, kind of the way that he's walking a little bit back and forth, I'm like, does he have some type of a problem with his back, with his spine? He's 79 years old again, so he certainly could have arthritis, specifically osteoarthritis of his backbones. He could certainly have some type of a pinched nerve. Could he have a tumor? I'm not speaking these things on Trump's life. I'm just talking about the things that I think about. And so could he have had an MRI of his spine, of his cervical, thoracic, lumbar spine? So the spine in the neck, spine kind of in the chest, and the spine down low in the back. That could pick up if there's something that's causing you to walk in an abnormal fashion. We don't know, but that's something that's a possibility. And then what really went viral, and again, I encourage you to check out my short form content. It's right here on YouTube. I also have it on IG, Facebook as well. Replay crew, y'all know y'all can look at it. But there was that event he had where a championship belt was placed on him. And there was really an odd bulge in his pants. It was like a kind of a square-like or rectangular bulge that was consistent with what could be thought of as a Foley catheter. Okay. And so a Foley catheter is a tubing that's placed in the bladder for different reasons. If a man has urinary retention, meaning he's got a blockage to his flow, he can't get rid of urine properly, the Foley catheter can go in and allow him to be able to urinate with the normal flow. And this can happen for many reasons. One is if you have BPH, or large prostate, benign prostatic hyperplasia, that's quite common in men. Also, if you had surgery. So if he had surgery for a large prostate, or if, Lord forbid, he had prostate cancer, that might be a reason to have a Foley catheter. Or even if he had a neurological issue that interfered with his control of his bladder, a Foley might be placed. This is not something that's uncommon in men who are almost 80 years old. I'm a kidney doctor, so of course I deal with kidneys, bladder, and I have certainly seen all the reasons for Foleys being inserted and for being left in for you to go home with. And if you check out that short form content I'm talking about, I do have imaging of what a Foley catheter looks like and what he looked like, Trump, with that abnormal bulge. And you could argue that the look is consistent. Again, we don't know. But if that's the case, if he has some type of a prostate issue, a prostate pathology, then perhaps he had a prostate MRI, which would be a way to assess for prostate cancer. Okay, so these are just some of the possibilities based on this second visit. So was the second visit routine, or is it a red flag? I certainly think it's a red flag, not in the sense that I think, oh my gosh, it's final, we're in gloom doom, but certainly it's not routine the way that the White House is explaining, especially that little press secretary of his. She's like, oh, it's advanced imaging. All the presidents get it. No, they don't. I just don't like it when we as a public are lied to. And that's what's happening. If they're trying to tell us that the MRI was done for no reason, everything was routine, it's just not. That's not standard of care. I've certainly been a physician long enough to know. And so that's where I am with it. So anyone else make any comments? And then we'll move on to some of the other medical issues that he's had in the past and how the White House has explained them.
Yes, ma'am. Ava, hello.
Hello.
Ava says privacy. Biden never had checkups with info released.
Oh, that's interesting. And it's actually not true. Biden absolutely had checkups, and he absolutely did reveal his entire report, right down to his height and his weight, and his actually seemed accurate. And you'll even note now, we knew that when President Biden had skin cancers removed, okay, that was shared. We now know that President Biden, who's not even president anymore, he has prostate cancer, which has spread. And so I'm sorry to tell you that what you're saying is not true. President Biden absolutely did release his information. Yeah.
Okay. Muka says, no, unless his mental or health is on the brink. I don't think it's our business that he gets MRI.
Okay. So that's interesting that you said that. And so you said unless it's mental. And so with the first examples that I gave, I talked about things mental, be it stroke, be it dementia. We don't know. So if those things that I'm sharing are true for him, then you would agree that it should be released. And I also mentioned if he were having a prostate MRI to assess for prostate cancer, that's certainly serious. And so it sounds like you do agree that if it's those things I've mentioned, prostate cancer or a neurological decline, then you would want to know. Okay, so I mean, that's fair. If it's something that would actually affect him either being alive to be our president, or if it would affect his mental ability. But for every little thing, you don't necessarily think we need to know. That's fair. Okay.
And then one more, Miss Audrey.
Hi, Miss Audrey.
It says Trump, the public needs to know he makes decisions that impact the world.
He absolutely does make decisions that impact the world. And so I do agree. Although I do like what the previous person said, perhaps with some discrepancy. But if it's something that's going to affect his living or his ability to be well enough to have our nuclear codes and to impact the world, or to even launch wars, as there are talks of now, then we as a public will need to know. And especially there are talks of him running for third term. Now, clearly that is unconstitutional, but we seem to be with an administration who is doing things that have never been done before. And they have things set up in a way where even things that are unconstitutional, I'm sad to say, could be possible. So certainly if he were going to run for a third term, we absolutely, I do believe, would need transparency. Okay, very good. So now let's talk about a couple of health issues that he's had in the past that have been discussed. And one, the chronic venous insufficiency. So, he had those swollen ankles. He still has swollen ankles. And the explanation that we were given from him, from his team, from the Carolyn Levitt, the press secretary, they said that he had chronic venous insufficiency, which is actually a benign condition, okay? Not cancerous, not life-threatening. And that's when the valves and the veins in the legs aren't working the way that they should, and you get a backup of fluid, and you can get swelling in the legs, you can get spider veins, you can get varicose veins, discoloration, things of that nature. Well, if we were to believe that they are being transparent about his health, well, that explanation is simple enough. But let's just go and play medical detective again, because nothing really happens usually in a vacuum. Oftentimes different symptoms or signs are connected. So when I think about this as a physician, I think about the swollen ankles. I also think about the bruising in the hands, so much so that they've been using makeup to cover up his hands. And, I kind of try to put these things together. So some other causes of swollen ankles outside of chronic venous insufficiency would be DVT, or deep vein thrombosis, if you had a blood clot. And this could happen if you had a hypercoagulable state, like what we talked about with primetime Deion Sanders having. If you have a thrombophilia, a tendency to clot. Okay. And, and blood clots in the legs are pretty common. They can actually be life-threatening, because if a blood clot breaks away from a deep vein in the leg, it could go to the heart, causing a pulmonary embolism, or a PE, a blood clot in the lungs, and that could be fatal. Okay, so that's a possibility. I will state that they have stated that he does not have a DVT. But as I'm just thinking about the possibilities, and I do question the transparency, it's something that as a physician, I kind of keep in my mind. So what would increase someone's risk for having blood clots? Many things. If you're sedentary, he doesn't seem particularly sedentary. He seems to move around a bit. Also, if you are a smoker, he's not a smoker to our knowledge, or you can have some type of a genetic predisposition. Like some patients with lupus will have, certain issues, anti-cardiolipid antibodies, antiphospholipid antibodies. There are things that can put you at risk. But something that I would think about in a man who's almost 80, cancer or malignancy can cause you to have clotting predisposition, to have, a likelihood of being in a hypercoagulable or hyperclotting state. So then that takes me right back to the MRI. If he did have blood clots, which again, they say that he didn't, I'm not his doctor, I don't know. This is all we're playing medical detective. But if he did have blood clots, then you would want to make sure he didn't have any cancer or malignancy. So then you might do essentially a full body scan to make sure he didn't have anything going on in his liver, his lungs, his gallbladder, his pancreas, his stomach, his esophagus. So that's a possibility for an MRI. Again, they haven't shared, but just for learning purposes, right here on the Dr. Frita channel, that's what we do. We take what's in the headlines and we use it not to be salacious, but to learn. And also to kind of think about yourselves and your loved ones. If any of these symptoms that I'm mentioning or signs that I'm mentioning hold true for you or for someone you care about, I want you to think about it and just kind of take it back to your doctors as food for thought. The other thing, so let's connect the swollen, and there are other things that can cause swollen legs, peripheral vascular disease, lymphedema, peripheral artery disease, things of that nature. If you have hypertension and you have a really high salt retention, and if you have kidney disease like nephrotic syndrome, where you're leaking out protein. Also, if you have malnutrition, like a protein malnutrition, he doesn't appear to have malnutrition. He appears to be overweight or even living with obesity from appearance. So, but you actually can be someone who has excess adipose tissue or fat weight and still have a protein malnutrition. So it's still a possibility. So there's just some other things in the thought and the differential diagnoses. So let's take the swollen legs. And again, officially, the White House said that he has chronic venous insufficiency, which is common and benign. But these are the thoughts as we play medical detective on what could be going on with Donald Trump's health, especially given that with this latest information they shared, it does not appear that they're being fully honest or transparent. All right, so we'll move on to how I connect my thoughts with the hands and the bruising. But does anyone else have any comments or answers to my question on President Trump?
Yes, ma'am. Okay. Just Bridget.
Hi, Just Bridget.
We need to know, especially in regards to mental cognition.
I agree. Especially, there are talks about war. And I saw where he put out, I don't know if it was on Truth Social, but he put it out in social media about possibly, entering into some war with Nigeria or saying that Nigeria was anti-Christian. I didn't see that one coming. And so if you have someone who is potentially going to launch war, then yes, we are talking about an international, worldwide situation, consequences. So you absolutely need to have a president with all mental faculties. So I agree with that. Thank you.
Joyce. Hello.
Hi, Joyce.
She says we should know if our president is in good health. We sure don't need what we went through the previous 4 years.
With the previous 4 years. Okay. So what did we go through with the previous 4 years? So without getting too political, if you actually, go through and see what we went through as far as what happened with this country, everyone will have their own opinions. I will say this, when President Biden had what visibly was seen like during a debate with President Trump, President Biden clearly seemed like he was not mentally there during that debate. He was having trouble speaking. He seemed to have trouble connecting his dots. And certainly he's someone who's in his 80s. In those his latter portion of his term, he seemed to, have some issues that we saw publicly as far as mental health. Now, people will tell you who were with him and who knew him well, that he was still sharp. But again, when we're sitting here, we're just talking about what we see. So let's just go by that debate specifically. After that, you see what happened. President Biden didn't run for re-election. And while he didn't actually say his reason for not running, one might speculate it was because there was a confidence loss based on that performance. And so when you talk about we don't need to go through what we went through for the last 4 years, I'm not exactly sure what you're talking about, but keeping it medical, I will say that he did show some signs of cognition issues, at least during that debate in different times where he had slowed speech. He's come back since, he's had times of being completely clear. We know sometimes mental issues wax and wane. Now we know he has metastatic prostate cancer. And even during that time, we found out soon thereafter that he had some type of infection. But I don't care who the president is. I believe there should be transparency with all. And I think that we agree on that, at least the last person who made the comment. Yeah.
Right. And Yolanda, hello.
Hi.
Question really quickly. She says, Dr. Frita, would that MRI be a PET MRI instead of a regular MRI?
We don't know. It hasn't been shared. All he said was that he had an MRI. His doctor said that he had advanced imaging. Now, when you're talking about PET, you're talking about nuclear medicine. I know that's something that can be done for many reasons. You can have a cardiac PET to kind of see where you are as far as heart disease. You can have a PET to see if you have cancer or any recurrence of cancer. And so we don't know what kind of MRI he had. So the PET would be nuclear medicine, the MRI, magnetic resonance imaging. The MRI would be a way of looking at the brain, the spine, anywhere in the chest, abdomen, pelvis, anywhere to give you a really detailed analysis of soft tissue and bony tissue, hard tissue as well. But that's the point. We don't know. Now, we don't know what kind of MRI it was. We don't know what the MRI was of, what body part. They're talking about it like it's routine. It is not a routine examination. Now, that is not speculation that I know. It's not routine for him to have had an MRI. Okay.
All right. Thank you, Dr. Frita.
Okay. And so the other thing I want to mention, that bruising of the hands. So let's bring that back into the differential diagnosis. The White House explanation, the press secretary's explanation was that President Trump takes aspirin, like a low dose aspirin, I'm presuming, which can help to prevent heart disease. And she said that he does a lot of handshaking and that's why he's bruised. Well, you shake hands with the palms, right? Not necessarily with the outside, but let's just say that they squeeze the outside of his hand. Okay, that's fine. But the truth of the matter is, President Trump is not the first president likely to have taken aspirin, right? Because there was a time where it was recommended for anyone over 40 to take a low dose aspirin, 81 milligram aspirin, in order to prevent heart disease. Those recommendations have changed over the years. And so consult with your doctor. Okay, it's actually specific to you as an individual, whether or not the risk outweighs the benefits. But at one time, it was recommended across the board, unless you had an allergy or contraindication, a reason not to take it, then taking a low dose aspirin was recommended. So he wouldn't be the first president to have taken aspirin, certainly not the first president to shake many, many hands. And so her explanation did not make sense for them to be up there covering up his hands with makeup. What would make sense if he's taking perhaps a stronger blood thinner. And why would he take a stronger blood thinner like an Eliquis or warfarin, something like that, Coumadin, if he had a hypercoagulable state, if he had a DVT, a blood clot, as we discussed? Again, I don't know. This is a medical exercise that we're doing for learning, but that is my thought. Is he taking a stronger blood thinner? And is that why he has the bruising? So we don't know. We don't know. But what we do know is that there has not been transparency as far as this second visit to Walter Reed Hospital. There's not transparency thus far about the MRI. Yeah. Okay. Anything else?
No, that's it on that one. We can shout out before we move on, Dr. Frita.
Okay.
Ms. Andrea is joining us, member.
Hi, thank you for being a member. I always love having you here, Ms. Andrea. Thank you. All right. Make sure you give us a like, give us a subscribe, give us a follow. Here on the YouTube channel, we have over 910,000 subscribers. And I want to thank you to everyone who joins us, to everyone who subscribes, everyone who participates. Over 910,000 subscribers here on the Dr. Frita channel. And what we do for you here is that we do give you evidence-based information. And if you check us out and you go to our videos, you'll see hundreds and hundreds of videos where we talk about a kidney disease, high blood pressure. We talk about infections. We talk about the flu. We talk about pneumonia. We talk about prostate cancer, breast cancer, lung cancer. It's just about any topic at this point. And if you have suggestions, let me know. But it gives you evidence-based information. And so if you're someone who's worried about a health problem that you have, or if you're going to see a doctor and you watch my videos, it'll give you some food for thought. And very importantly, it will give you certain key terms, certain medical terms, so that if you're concerned about, doctors kind of passing you off or being condescending, when you go in having a certain knowledge and you're able to use terms, it kind of, will make the doctor sit up straight and make sure it'll make them understand that you care about being an advocate. And so those videos are meant for you to learn. They're also meant for you to share, to advocate for yourselves, and to help your loved ones to advocate. So make sure you give us a follow. Check out these videos. You won't be disappointed. You won't be disappointed. All right. So let's move on to another piece of our weekly dose where I give you a fresh take on the headlines you simply can't get anywhere else. This next one is a pretty sad one, Shador. There was a star of Fresh Prince of Bel-Air. He actually played young Will's character, the Fresh Prince. He played the young Fresh Prince as far as his acting. And he has actually passed away at the age of 42. He was in the Jackson movie also where he played Marlon Jackson. But he passed away at the age of 42. and he had 4 heart attacks before turning 42. So let's play this clip, at least a portion of it, and then we'll talk about heart attacks. And what I want you to do is put heart, or just give me a heart emoji. And then next to that, I want you to write down some signs and symptoms, some warning signs of heart attacks.
Fresh Prince of Bel-Air child actor Floyd Roger Myers Jr. has passed away at the age of 42. According to his mother, Renee Trice, Floyd died early Wednesday morning at his home in Maryland after suffering a heart attack. She told TMZ that this wasn't the first time her son had faced heart problems. He had survived 3 heart attacks in the past 3 years. Renee said she spoke to him just the night before he passed, not knowing it would be their last conversation. Floyd Roger Myers Jr. was once a familiar face for fans of The Fresh Prince of Bel-Air. He played the younger version of Will Smith in the hit sitcom, a role that made him instantly memorable among viewers who grew up with the show. His acting career continued with another standout performance portraying a young Marlon Jackson in the acclaimed TV miniseries The Jacksons: An American Dream.
Yeah, that's so sad. 42, you're really just kind of getting your feet on the ground. And he had 4 children. He had 4 children who have survived him. So I'm really sorry to hear that. But, when you hear that, someone passing away at the age of 42, that seems so young. We do know that heart disease is the number 1 cause of death here in the United States. And there are many risk factors. We know that living with obesity is one. He certainly didn't appear to be obese. Being a smoker of cigarettes, having diabetes, having kidney disease can put you at risk. Also, having high cholesterol or dyslipidemia. And I'll tell you, there is a condition called familial hypercholesterolemia, and it is a genetic predisposition to extremely high cholesterol. Even if you do all the things right, if you're, at a healthy weight, if you exercise, if you don't eat a lot of animal fat, if you have that genetic predisposition, it would give you extreme, dangerously high levels of cholesterol, which will put you at risk for having heart attacks with your arteries being clogged with that thick blood cholesterol. And that's something that we see when we see women and men who have heart attacks at early ages. Family history also puts you at risk, especially if you have a family history of someone who had a heart attack at a young age, like less than 55 for women and less than 65 for men. And so I'm not aware what his condition was, if it was congenital or if he did have that familial hypercholesterolemia, but we've lost him. So please make sure, we have a lot of men who feel invincible. They don't have symptoms. They don't go to the doctor. Women too, for that matter, a lot of super women, but just make sure you pause and you love yourself enough to go to see your doctor. They can do cholesterol checks, just general health checks, and assess your risk factor for the number 1 cause of death, which is heart disease. Do we have any heart emojis in the chat? Anyone comment on what some warning signs of heart disease might be?
Yes, we do. And I'm going to start with IG.
Hey, IG. Oh, wait. Now, IG, thank y'all for joining. And we're moving on up in our subscribers. We have over 57,000 followers in IG. And I'm really excited. Those are all nice organic followers who come by and say hi and check me out. So I appreciate you over there in IG. But you'll see there where I have the video from homecoming to Halloween, where I talk about my 9th grade twins. I did that over there. You'll also see the Trump video where I talk about the Trump MRI and a nice kind of a short, easy to share version on a reel over there. And I give you my perspective on Trump's MRI. All right. Who do we have on IG?
All right. This comes from Bobo, pre-med student.
All right. Ooh. Okay. I hope that you're treating studying like your job, because it is. Even when everyone else is having fun and playing and down to the club, you can take breaks, of course, for social life. I definitely did, but you schedule them. All right. Good luck to you in medical school.
Bobo says chest pain radiating to the jaw.
Absolutely. So chest pain radiating to the jaw is a classic one. You can also have chest pain that doesn't radiate. Classically, you think of it to the left jaw or even the left neck or left arm, but we do know it could be both jaws. It could be both arms. It could be the right. So chest pain is definitely one, and not just a little bit of run-of-the-mill chest pain for most people, although symptoms vary. People talk about it as being like an elephant sitting on your chest, right? Okay, so that's very good.
All right, sticking with IG, Lucy. Hello.
Hey, thank you from IG, Lucy.
Lucy says back pain.
I'm glad you said that. So that's one of the atypical ones. And we know that a lot of women will have atypical warning signs for heart disease. So yes, back pain could be a warning symptom of a heart attack. So don't ignore it.
All right. Aileen, Miss Aileen, hello.
Hey, welcome back, Miss Aileen.
She says shortness of breath.
Absolutely. You can get shortness of breath. And a lot of times when people hear about shortness of breath, you think lungs, you think asthma, you think bronchitis, but shortness of breath can definitely be a warning symptom of a heart attack. Very good.
All right. You already mentioned Christine's family history.
Kristen, yeah, but yes, family history of a heart attack. Certainly, if you have young people, less than 55 in a woman, less than 65 in a man, but really any age, if you have families that have heart disease, you want to find out, do you have some type of a genetic predisposition? Do you have familial hypercholesterolemia, or do you just have arteries that, for whatever reason, have a predisposition to getting plaques or atherosclerosis? But yeah, our secrets make us sick. When you go to homecoming, when you go to Thanksgiving, listen, ask about the family history, not just of the living relatives, but for those who've passed. You'll be amazed at what you find out when you do this kind of family tree. Good.
All right. Miss Valerie.
Hello, Miss Valerie.
Nausea and cold sweats.
You better come to the front of the class. Absolutely. Nausea is not just stomach problems, right? So you can get nausea, you can get vomiting, and patients who have diabetes will tend to get nausea. Women also, again, women often get these atypical symptoms, and especially if you're a superwoman trying to be there for everyone else, sometimes you'll ignore your own symptoms, take a little Pepto-Bismol and leave it be. But if you're getting nausea, especially if the nausea is worse with exertion, okay, then certainly nausea and even vomiting could be a warning for a heart attack. And then diaphoresis, so breaking out into a cold sweat, another warning that could be a heart attack. Very good.
All right. Christine added heartburn. That's
Heartburn.
unusual.
Right. So you might think it's just, oh, I got a little heartburn, or oh, maybe I ate something, but they call it heartburn because it's located in the same place of cardiac pain. So don't ignore it. And of course, you put some of these symptoms together. If it's something that's getting worse, something that's worse with exertion, if you're getting more than one of these symptoms, the diaphoresis, the nausea, the back pain, the radiation, even if it is to the right, jaw, arm, all of these things, don't just sit home and guess. Please call 911. And please don't try to drive yourself if you suspect that you might be having a cardiac event, because what you don't want to do is fall out in the highway and then risk your life along with the lives of others. Don't be ashamed to call 911. It's the most common cause of death, heart disease. And so let's go ahead and try to prevent it. All right, good. That's some good.
Speaking of prevention, Dr. Frita, I remember Miss Pauline.
Hello, Miss Pauline. Thank you for being a member.
She says, hello, classmates. Miss Pauline says, I have been having palpitations, and my primary care gave me a Zio monitor, or heart monitor to wear for 14 days. Cholesterol levels are good. My father died at 59, I'm assuming, from heart.
Okay.
So she's taking the steps that she needs to.
Thank you. I'm extremely proud that you're doing that. And I really, 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 really appreciate you for coming on this platform and sharing it, because yes, you're doing the exact right thing. You know, is checking it out with a heart monitor to make sure there's no abnormal heart rhythm, nothing that there needs to be intervention for. And your father having it before the age of 65, assuming it's heart disease, that is considered to be early. And he's a first degree relative to you. So when we say first degree relatives, you're talking about parents, siblings, children. That means that's very close to you. And so certainly I pray that you don't have anything that's wrong. But if it is there, then I'm very happy that you're being proactive, and so that you can treat it and we can work on prevention. So thank you for sharing. Yeah.
Yeah. Thank you, Ms. Pauline. And huge added to the list.
Welcome back.
In the neck as well, and fatigue.
Very good. So yeah, so our medical student mentioned the jaw, but yes, pain, the neck also. And it could be left neck classically, and absolutely fatigue. So angina, we typically think of it as a chest pain with exertion, but angina could also come in the form of fatigue with exertion. And I don't mean fatigue after you run 6 miles. I mean fatigue after maybe just, walking a block, walking 10 steps, walking to the restroom, a fatigue that's abnormal for you. So yes, that definitely could be a warning for a heart attack. Very good. Okay. All right. Good stuff. Make sure that after you finish this live, you check out my video right here on YouTube. Videos. I have videos on heart disease. I have videos on cardiac arrest versus heart attack. I have different videos on how to unclog your arteries naturally. Okay. Natural ways to try to reduce your cholesterol. So check it out. I have a plethora of videos right here on the Dr. Frita channel, where we have over 910,000 subscribers. If you haven't subscribed, please be a dear. Hit the subscribe button, because we're trying to get to 1 million. Also, make sure you share the link to what we have going on now. Let YouTube know we're here. Let them know we're here. So put it in your group chat, put it in your WhatsApp, put it in your text messages, send it to your mama, your daddy, your sister in the alley. Just send it to everyone and let them know we're here, please, giving good evidence-based information. All right, let's take a little break from this weekly dose Shador and play my favorite little game, shall we?
Yes.
All right. So myth versus fact. Today, we're going to be covering the flu versus pneumonia because it is flu season. Flu before boo. We classically recommend getting the flu shot before Halloween. Halloween is past. I got my flu shot, but it's not too late. Consult with your doctor. All right, let's play this clip. And then we had actually, Shador, a good question from a viewer. And I want to take this time to break down that question before we get into our myth versus fact statement.
All right, we're gonna play the clip first.
Yes, please.
All right.
We get further into fall, flu concerns are going up. I'm Colin Mayfield.
And I'm Vanessa Rufus. Last year's flu season did mark the highest activity for cases in a decade. So folks might be wondering what we'll see this year.
WCNC Charlotte's Bria Smith spoke to a local doctor about what people can look for or look towards and what you can do to help you and your family flu.
Before you start to feel the itch in your nose, the pain in your throat, or your body temperature rising, you can get a head start in saying no to the flu this season. A tissue and a proactive approach this flu season can wipe away more than just a congested nose.
You can get some tests from over the counter, or you can go see your doctor and get tested.
Aside from testing and getting a normal flu shot, Dr. Ryan Stempenak says the Flu Mist nasal spray vaccine can help as well.
Flu Mist is a vaccine that can be mailed to your house. You can sign up online, and then they have a provider review if you're a candidate for it. It's a similar efficacy to the flu vaccine that you can get from the pharmacy or your doctor's office. About 30 to 60% effective in preventing against developing the flu.
Last fall, flu cases were at an all-time high.
It was pretty bad. We were pretty busy just seeing a lot of different flu cases.
Dr. Stempenak says with new strains of the infection, you'll want to be sure you know which one you might have.
Most of the time, there's a dominant.
All right. That's good. So if you want more information on the flu, then again, right here on the YouTube, on the Dr. Frita YouTube channel, I do have a video on influenza explained where I go into details on what the flu is. But also make sure you consult with your doctor because anywhere from 6 months up, it is recommended that you get the flu vaccine. Of course, weigh the pros and the cons and find out, but certainly consult with your doctor. Like I'm in healthcare and oh my gosh, for those of you who are parents of vulnerable children like NICU babies, or if you're around the elderly, people who are immunocompromised, I would certainly strongly consider getting the flu vaccine because even if you might be a healthy person and you get the flu and you're fine, you don't want to get the flu, pass those germs on to someone who is immunocompromised and make them very ill. And yes, I have had patients to pass away from the flu. The flu can take your life, okay? It really can. So Shador, before we get into our myth versus fact statement, I do want to answer a question that we had from a viewer. Do we have that question? If you could read it, if we do, yeah.
Yes, this is from Jordan.
Hi, Jordan. Yeah.
Why did you say that it was a fact that you get pneumonia from a germ, not people, but tell people to get the flu shot because people are out there riding the bus and such with other people? What's the difference between pneumonia and the flu?
Okay, so we'll start with the first part. Why did I say that you get pneumonia from the germ and not people? It was the way that was framed was, if there's a question, can a person with pneumonia give you pneumonia? Can you pass the lung infection to another person? So in other words, if someone walks in, they have pneumonia, can they give it to me in pneumonia to pneumonia? What happens just from a technical standpoint is not the lung disease that's being passed from the person, but it is the bacteria or the virus or the fungus. It's the pathogen, the germ that's being passed. So case in point, let's just take someone who's a pretty healthy person. Let's just take a 25-year-old athlete who's super healthy. And let's just say that person gets a bacteria. They get streptococcus and they get a little bit of a sore throat. They have the bacteria, they're fine. Well, they might pass the bacteria on to their grandparent or to someone who is sickly or to someone who's on chemotherapy, and they'll pass the bacteria on, but the other person might actually develop pneumonia, the lung infection. Okay, take it from there. So let's say that you have a grandparent, someone who's 78 years old, and they have pneumonia with that same bug. Well, a 36-year-old super healthy person might walk in the room, and if that grandparent coughs, they cannot give pneumonia to the other person, but they can pass on the germ, the bacteria. Now, if it's a super healthy person, that person probably won't get pneumonia. They might get an ear infection. They might get a throat infection. They might get nothing. Their immune system might attack and they never even knew that they were exposed. So the only point is that when you have pneumonia, it's not the lung infection that you spread to another person. It's the germ that causes the lung infection. So what do? Well, you're proactive. You make sure that if it's a season like it is now for COVID, flu, and you're going to be in a tight situation, you consider wearing a mask. Make sure that you cover your mouth like the old-fashioned that dab that used to be out. Oh, look at me dab. You make sure that you cover your mouth with your elbow, that you do a lot of hand washing, that if you're touching different things, elevator buttons, door handles, railings of staircases, that you don't go and get some food or you don't wipe your face, that you do a lot of frequent hand washing or using hand sanitizer. So these are ways that you prevent getting the bugs. But in the most technical of terms, pneumonia is not picked up and you give someone else a lung disease. It's the infection that's passed on. Okay. And then the next question was the difference between the flu and pneumonia. The flu or influenza is a virus, and that virus can cause someone to be sick. It can cause you to be septic. The influenza can cause encephalitis in extreme cases, and influenza can cause pneumonia, which is a lung infection. So pneumonia specifically is an infection of the lungs. Flu is a virus. Influenza, which can cause many different types of infections. So I hope that answered that question. If not, then please go ahead and give us a call back and I'll come back and I'll try again. I appreciate your participation. And I always appreciate when people ask for clarification. So I hope that helped. All right. So now, myth versus fact. Y'all know you can't get away without playing my favorite little game, myth versus fact. Let's put that statement up and please read that for me, Shador.
All right. Pneumonia can be caused by both viruses and bacteria.
All right. Put an M if that is a myth. Put an F if that is a fact. Okay. Pneumonia can be caused by both viruses and bacteria. M if that's a myth. F if that's a fact. Pencils down, pencils down. Let's see who's quick on the draw today.
You barely gave me time today.
I ain't giving me time. Y'all don't need any time. Let's go. Y'all warmed up already.
All right. So Ms. Pauline, member, says a fact.
A fact. You think a virus can do it and you think bacteria can do it. Okay. Hi, Ms. Pauline.
Ms. VE, hello.
Hello.
Time.
Welcome back, Ms. VE.
She says a fact.
Okay. See, they ain't need any time. Okay.
Yolanda says a fact.
Hello, Yolanda. All right.
Elonia agrees.
Okay, another fact.
Michael Jackson's shadow agrees as well that it is a fact.
So y'all are all on the same page. That's not fun. Who else?
All right, and Brandy says a fact as well.
Hey, Brandy. Now, why your name Brandy? Because you know I'm trying to go to the Monica versus Brandy concert. Her second date, I believe, is tomorrow. My cousin went to her Halloween date and said that it was phenomenal. And she said that Brandy's vocals were spectacular. Oh, goodness. All right, Brandy. Thank you.
We do have a couple of on IG.
Okay, come on, IG. What y'all say?
Graham says a myth.
You can see it's a myth. You don't think it's caused by both bacteria and viruses. Okay, Graham.
Mm-hmm. Babo agrees that it's a myth.
Okay, hi, Babo.
Sweet Daddy says fact.
I know your name ain't Sweet Daddy. Hey. All right, you say it's a fact.
And Lucy says a fact as well.
Hi, Lucy. All right. Anybody else?
That is about all. Miss Sheree chimed in. It's a fact.
Thank you, Miss Sheree. Sheree, you've been with us from the start, so welcome back. So you say it's a fact. All right. The answer is, drum roll. It's a fact. It's a fact. So, pneumonia, again, is the infection of the lungs, right? And it can be caused by bacteria. It can be caused by viruses. You can even have a fungus that causes the pneumonia. And so, yes, there are many different types of pathogens or germs that can cause pneumonia. And we know that Diane Keaton passed away with pneumonia. And then later it was shared that she actually had dementia as well, reportedly. All right, let's jump back into this weekly dose. Let's give you your second dose. So there's an NFL player. We have all these young people with bad news, Shador. Mm-hmm. And at the age of 41, he has passed away from kidney disease. His name was Nick Mangold. And he shared that he actually was diagnosed with this kidney disease, and it was genetic for him back in 2006. I have not seen where he actually listed the specific type of kidney disease. If anyone in the chat happens to know, then let me know. But when I was doing my research, he said it was a genetic disease that he was diagnosed with in 2006. But I don't know the specifics of it. But let's go ahead. Let's play this clip. And then I'm going to ask you all the question. What do you think some signs and symptoms of CKD, chronic kidney disease, might be? And
The
put
New
kidney.
York Jets announcing today that their former All-Star center Nick Mangold has died at just 41 years old. According to the team, Mangold died from complications of kidney disease. Just 12 days ago, he made a public appeal for a kidney donor. Joining me now with more on kidney disease is emergency medicine physician Dr. Neil Bhavsar. Doctor, what causes chronic kidney disease and why is it so often missed?
Hey, Andrew, how's it going? Thank you for having me. This is a very tough case. Chronic kidney disease is a gradual loss of kidney function over time. It leads to a buildup of toxins, which can be very deleterious to the body. The thing is that's very subtle at first. Not many patients know that they have it until the later stages. You usually notice some malaise, some fatigue, some leg swelling, and changes in urination. And that's why frequent visits to a doctor is very important. We as physicians typically diagnose with blood testing and urine testing.
And you mentioned that those symptoms could be subtle at first. And I found this timing to be so interesting. Mangold's death came just 2 weeks after announcing that he had kidney disease and needed a transplant. Who qualifies for a kidney transplant? What's the average wait time for a kidney?
So those who qualify for a kidney transplant have end-stage renal disease. End-stage renal disease currently affects about 800,000 Americans in the United States, according to our organ transplant networks. Those who have end-stage renal disease qualify for a transplant, which would be up to a 3 to 5 year wait from a deceased donor. And from a live donor, it can be a lot sooner, but there are a lot of complications.
Okay. Yeah, so I'm sorry to hear that this young man died at the age of 41. It sounds like it wasn't a disease that popped up on him, that he had it from the age or from 2006. And I will tell you, and of course, I'm not Nick Mangold's doctor, but if he had the disease since 2006, certainly there are many genetic diseases that you can have, and we'll talk about some of them. For him to pass away, 2 weeks after he made his announcement, he did share that he had gone ahead and started dialysis. The number one cause of death among kidney patients is actually not the kidney disease itself, but still it's heart disease. And he also had 4 children and he had a wife. So I'm sorry that that happened. So 35 million people have CKD and most don't even know it. There are many risk factors for it. The number one cause of kidney disease is diabetes. The number 2 cause is high blood pressure. And then there's a list longer than my arm of other causes, including genetic diseases. So when you think genetic, you think things like ADPKD, so autosomal dominant polycystic kidney disease. You think things like IgA nephropathy, which is a kidney disease that can occur where you'll get blood in your urine, especially at the time that you have a cold. You can have different genetic causes for nephritic and nephrotic syndrome. So again, check out that video that we have right here on the Dr. Frita YouTube channel, nephritic versus nephrotic. Lupus nephritis could be considered genetic because, lupus is one of the causes of inflammation of the kidneys. And I definitely dialyze patients because they had kidney failure from lupus nephritis. Sarcoidosis can cause kidney disease. And there's something called ApoL1, and that's more common in people of African descent. And we're really getting great research on that now. So APOL-1. If you are someone, particularly if you're of African descent and you have kidney disease and you just really, your doctors don't seem to be able to tell you why, ask them specifically for genetic testing and for ApoL1, because having ApoL1, having 2 of those genes, being a homozygous person who has ApoL1 increases your risk exponentially for high blood pressure, which is the number 2 cause of kidney failure, and for FSG, focal segmental glomerulosclerosis, which is another genetic cause of kidney disease. So I don't know what his genetic cause was. I mean, could have been Alport syndrome. That's another genetic cause. But We do know that he had it, and unfortunately, he passed away. Make sure that after you finish watching this live, you check out my videos here. In fact, go to my playlist on YouTube on kidney disease. I talk about CKD stages. I break that down to help you know how to read your labs. I have many videos on kidney healthy foods, so foods to help to repair kidney disease, on juices and smoothies to help repair kidney disease. I talk about warning signs and symptoms of kidney disease, just a plethora of kidney videos. I talk about nephritic versus nephrotic syndrome, foamy urine, what that means, kidney stones, you name it. I'm telling y'all, a wealth of information. It'll help you to advocate for yourself and to help your loved ones as well. Did anyone make any comments on any signs and symptoms? We'll hit on a few of them.
Yes, they did.
Okay. And make sure y'all give us a like. If you haven't pressed a like already, come on, do me a solid. Press a like and make sure you subscribe if you haven't subscribed. Here on the Dr. Frita YouTube channel, we have over 910,000 subscribers. We're trying to get to 1 million. So, por favor, help us out. Ayúdame, por favor, gracias. Okay, now, who else? Who says?
All right. So, Yolanda.
Hi, Yolanda.
She says a few: puffiness around eyes, frequent
Good.
urination at night, and shortness of breath.
I agree with all of it. So puffiness around eyes. If you have salt retention, you might be getting puffy eyes or periorbital edema. Also, if you're leaking protein and you have nephritic or nephrotic syndrome, getting up at night. When you have CKD, sometimes you're not concentrating your urine well. So you have a really dilute urine, and that can make you get up at night a lot. Also, if you have the number one cause of kidney disease, like if you have diabetes and you have sugar in your urine, that can make you get up at night. And what else did you say?
Shortness of breath.
Shortness of breath. Yes, you could just have fatigue and be short of breath if you have CKD. Or if you're not urinating enough, you can have fluid in your lungs, pulmonary edema causing shortness of breath. Excellent. Come on up to the front of the class. Real good.
All right. Michael Jackson Shadow says sleep problems and urination more or less symptoms, or urinating more or less of signs of kidney disease. So sleep problems and urinating more or less.
Yeah, so you could do more, like getting up with the nocturia, or less if your kidneys simply aren't making enough urine because of advanced damage. And then, yes, having sleep problems. Specifically, you can get something called restless leg syndrome, which tends to happen at night when you're kicking your legs, and people with chronic kidney disease are more likely to have it. So that's a good one. So you come on up to the front too.
All right. I remember Miss Pauline says foamy or dark urine.
Absolutely. And if you have foamy urine, then there's a great chance that you could have protein in your urine. It's normal to have zero or very low protein in the urine. If you're leaking protein, that lets us know that there's something going on with the anatomy of your kidney. And then the more protein you leak, the protein going through your kidneys will actually damage the kidneys. And so proteinuria can be what is causing the foamy urine. Check out my video here on foamy urine. We talk about the signs and symptoms. And then dark urine. Yeah, if you're having issues with the concentration of your urine, then that could be an issue as well. Very good.
Okay. All right. I remember Mr. Joe says high blood pressure meds.
Hi, thank you. Ooh, Mr. Joe, you come on up here to the front of the class because you said a word. So yes, our blood pressure medicines definitely are here to help us, but there are certain blood pressure medications that can cause kidney issues in certain people. One being lisinopril, or the other ACE inhibitors, lisinopril, benazepril, ramipril. It's a great medicine. I do prescribe it. It's good for heart disease. It's good for early diabetic kidney disease. But if you're in a place where you have narrowing or obstruction of your kidney vessels, like renal artery stenosis, or if you are very dehydrated, or if you already have advanced kidney disease that's happening to get worse, then sometimes medicines like lisinopril can actually make your kidneys worse. Now, if you're taking lisinopril, don't get up and throw it in the trash, but consult with your doctor and ask, hey, could this be negatively affecting my kidneys at this point? Because it's quite nuanced, but that's very good. And even some water pills. Water pills, again, are great, especially if you have congestive heart failure, excessive fluid. But if you already have kidneys that are vulnerable to disease and you take a lot of water pills, a lot of diuretics like Lasix, furosemide, hydrochlorothiazide, things of that nature, then you can be over diuresed or have diuretics or water pills that are too strong. And so that's another blood pressure medicine that can cause it. So thank you, Mr. Joe, for bringing that up. And thank you for being a member. Good.
All right. Ms. Valerie named a few to add to the list.
Okay.
Nausea, changes in taste and smell, itchy skin, and sleep problems.
All of those things. So nausea, especially if it's advanced kidney disease and your BUN, blood urea nitrogen, check your my chart if that's very high. and that can cause you to have nausea. It can even cause you to have a metallic or a bad taste in your mouth and make you not be hungry. You can get itchy skin or pruritus, especially if your phosphorus is elevated. Your phosphorus is something that is found really all over the place, but it's found in a lot of preservatives, a lot of ultra processed foods and pancakes and hot dogs and milk. If your kidneys typically filter out excess phosphorus. But if you have CKD, especially advanced CKD, you can get a buildup of phosphorus in your blood, and that can cause itching skin. What else you say?
The sleep problems.
The sleep problems. So that takes us back to the restless leg syndrome. We're just having these toxins that are affecting your nerves, okay? Because uremia, having the high BUN, having the high kidney toxins can affect your nervous system. And of course, that can make you restless and not sleep well. Those are excellent. Come to the front of the class. Oh, I love the participation. I do.
Audrey shared, Dr. Free, this is different. My mother passed from CKD caused by hypertension, and a relative has it caused by their Sjogren's syndrome.
I'm sorry to hear about your mom. And yeah, high blood pressure that's the number 2 cause of kidney failure. Make sure that you check out my book if you haven't already. You can click the link in the bio or go to my one-stop shop, dr.frita.com. I did write a book, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about, yes, traditional ways to manage blood pressure. I also talk about how to lower blood pressure naturally. So check that book out, and it will be a helpful source. Let it be a stocking stuff for Christmas is coming out. But yeah, I'm sorry to hear about your mother. And Sjogren's, you brought up an autoimmune disease. You know, when we talk about autoimmune diseases, we're talking about your immune system, instead of just fighting bacteria and viruses the way it's supposed to be, where your immune system turns on you and starts to fight you. The same way an autobiography is a book written about oneself. An autoimmune disease is when your immune system, your antibodies, when they attack oneself. And Sjogren's is an example. And many of the autoimmune diseases will have antibodies that can turn and can attack the kidneys. They can also cause you to have high blood pressure crises in some cases. And so I'm sorry that happened. So same family, different causes. Make sure that you please follow up with your doctor and assess any risk factors you have so that their story doesn't have to be your story. Thank you for sharing.
And clarification, Angela, she's asking, is having high blood pressure or is it uncontrolled blood pressure that causes kidney disease?
Having uncontrolled high blood pressure. The thing about blood pressure is a lot of times by the time a person is diagnosed, they may have already had high blood pressure for years and they don't even know it because it can be a silent killer. And so oftentimes I'll have patients and they'll be like, well, as soon as they told me I've had high blood pressure, I've controlled it and it's been great. But in some of those cases, we don't know how long they actually had the high blood pressure that was already affecting their kidneys. So it's possible to have controlled high blood pressure, but already have had some damage that already started you with chronic kidney disease. But certainly if you caught that blood pressure by doing routine physicals, and if you caught it early before it had a chance to do anything, if you maintain good blood pressure, if it stays in good control, then you're not as likely. It's high blood pressure that is actually high, that's uncontrolled, that is more likely to lead you to having chronic kidney disease. Very good question.
All right. Thank you, Dr. Frita.
All right.
Oh, Ms. Pauline added fatigue and weakness.
All of it. Yes. Fatigue, weakness, those are some signs of kidney disease. Again, check me out right here on this YouTube channel where we have our playlist on kidney disease, and I have videos on warning signs and symptoms of kidney disease. Make sure you share them to little loved ones and family members you suspect. Share these videos. All right. Please make sure you go ahead and give us a like, give us a follow. Thank you for being here. If you enjoy having this conversation, become a member. And shoot, did we have a poll question up, Shador?
We did. We're doing the first segment with
President Trump. Look at that poll, give an answer, and then before we get out of here, we'll go over the poll question. And thank y'all for your participation. But we have the members only. I definitely have been putting out members videos for my resident members and above. And then if you're a chief member, a chief resident, then once a month we have our live Q&A the last Monday of every month, where for the entire time I'm not doing the talking, you're doing the talking, and you're asking me questions about your health, things you're curious about, loved one's health. What do I care? I'm just giving you medical information. And so you have that full access. Again, I have been quadruple board certified. I read medical journals every single day. And so you have access to be able to ask me questions about your medical health if you are a member at our highest level. We've been having a great time there. Also, if you want a one-on-one conversation with me, I do offer a telehealth concierge service where I can help you from anywhere in the world, where we go over your complete history and I give you medical information. All right. Now, I give you evidence-based medical information, but there's somebody who's in the cabinet who has been historically giving medical misinformation and disinformation, and that is none other than RFK Jr. None other than RFK Jr. You know, we've been on here talking about his misinformation about autism and saying that the measles vaccine caused it. Not true. No evidence to support him. He's given misinformation about Tylenol, saying that pregnant women should absolutely not take it. You know, at one point he was saying that and that it was the cause of autism in their unborn children. Well, guess what? He's backpedaling and now he's starting to say what more of us evidence-based physicians have been saying. Let's play that clip and let's talk about RFK Jr.
President Trump made it clear he is no fan of Tylenol after his HHS Secretary RFK Jr. claimed the drug is causing autism when taken during pregnancy. The president went even further than Kennedy, writing on social media, quote, "Don't use Tylenol unless absolutely necessary. Don't give Tylenol to your young child for virtually any reason." But on Wednesday, the secretary offered a more measured assessment, admitting there is no strong link between acetaminophen use and autism.
The causative association is not sufficient to say it definitely causes autism.
That's significant because earlier this week, Texas Attorney General Ken Paxton sued the makers of Tylenol, accusing the company of marketing a product it knew was dangerous. In a statement, Paxton claimed, quote, "These corporations lied for decades, knowingly endangering millions." But most healthcare providers are pushing back, pointing out decades of studies show no link between autism and acetaminophen.
Even RFK Jr. is now coming out and saying that you really should consult with your doctor and only take Tylenol when it's medical necessary. Guess what? That's what doctors say anyway, especially to pregnant women. We don't want you taking anything that you don't have to take when you're carrying life in your body. And so we already said that, RFK Jr., but, you know, thank you for coming back and agreeing with us who already told you. Also, you know, check out some of our past live streams here. We talked about how the former CDC directors came out and spoke against RFK Jr. due to his lack of medical information and the misinformation he's spreading. And then we saw all of the former surgeons general. I'm talking about 6 former surgeons general across party lines, those who were appointed by Democrats and appointed by Republicans, who came out and stated that RFK Jr. was a danger to the health of America. All right. But you know what? Here we give evidence-based information. So I thank you to everyone who tuned in. Make sure you give us a like, a follow, a subscribe on your way out the door. Again, I thank you to everyone who's helped us get to the over 910,000 subscribers that we have here on the Dr. Frita channel. I thank you to everyone, IG, Facebook, to my replay crew. I see you. I thank you. And check me out, because today, I'm going to post that there was a blood pressure medicine recall. Can you believe it? A blood pressure medicine that was recalled because it has potentially cancer-causing agents. It's prazosin. So I'll give you information on that. I'm posting short form content today. And make sure you check out my other short form content, the one that I just posted over the weekend on Trump and the MRI. It gives you a bite-sized version of it so you can share it more easily and digest it more easily. Well, we'll head out the door. Any last minute hooty-hoos before we head out the door, Shador?
I think I had a question for you.
Okay.
Christine.
Hi, Christine.
What order of flu, RSV, and pneumonia vaccine would you recommend we take, especially for seniors?
Let me tell you, consult with your doctor. I always say that because you actually can get multiple vaccines at the same time. And here I go telling my parents' business again. But my parents are in their 70s. They're elderly. Don't tell them. Are you watching Mom and Daddy? Anyway, they got multiple vaccines at the same time and did well. And so consult with your doctor. I certainly do prioritize all of the things. We're in RSV season. We're in flu season. We're seeing cases of COVID. And so consult with your doctor. But even in the elderly, they're able to handle more than one vaccine at the same time.
All right. Frita.
Well, thank y'all. Thank you to everyone for participating. Thank you to all of my members. Thank you to everyone who's just here on all platforms for your follows, for your subscribes, for your being subscribers. It's a free way to support the channel. I appreciate you. Hit that like button, please, before you go. And make sure you share the information. And follow me on all social media platforms, and I'll let you know when I do my next appearances, when I'm on different national shows, when I'm on podcasts, you'll know. And, that's how it's going to go. So I appreciate you, and thank you for making Monday your healthiest day of the week.